Hi, this is Michael Altos, and today we're talking about herbal remedies and dietary supplements, and this is part 1. First, a little introduction to the topic of herbal medications and supplements. These are defined as plant-based substances that have been taken or used for medicinal or health purposes. These are substances available without a prescription, but they're not legally considered drugs like over-the-counter medications. Since they're considered foods and not drugs, the need for proof of efficacy and safety is eliminated. These substances span a wide variety of different categories, including plant-based substances and synthetic purified chemicals, and they can be called herbal medications or botanical medications. Many people believe that herbal medications and supplements are natural, and therefore they're safer. But of course, there's no guarantee of any safety. Like I said, they're classified as foods, or actually dietary supplements, and so they can be exempted from all sorts of animal studies and clinical trials and post-marketing surveillance that looks for unexpected side effects and complications. They aren't really tested very rigorously for interactions with other drugs. And unlike medications, which go through a very rigorous process before being released to the market, dietary supplements have to have proof that they are unsafe before they can be withdrawn from the market. So we don't really know what's coming out of these bottles when patients take these substances. The products might be just inert, or they can be toxic, adulterated, misbranded, or contaminated. There's potential for quite a bit of variability in the potency of these drugs, and some of that may just be due to the natural variations in the batch that's being synthesized, as well as the methods of processing. Now, the FDA has applied some regulations for quality standards, but many of these questions still remain. And of course, when we have an unpurified extract or dietary supplement, there may be hundreds of active and inactive ingredients included in there. We should also remember that many of our most common drugs are plant-based substances, and these include drugs like atropine, cocaine, ephedrine, scopolamine, aspirin, caffeine, digoxin, morphine, and the chemotherapeutic agent Taxol. So the belief that natural substances are somehow safer than regularly available medications is a little bit misguided. When we worry about interactions between herbal medications and the drugs that we use during the perioperative period, we worry about direct pharmacologic effects on the body, as well as pharmacokinetic and pharmacodynamic interactions, which means the herbal medications could change the effect of drugs that we use, or they could change the absorption, distribution, metabolism, and elimination of the drugs that we use. So that's a basic overview to the topic of herbal medications and supplements. And for the rest of the recordings, we will discuss specific substances that are commonly used by patients. The first substance we'll discuss is Echinacea, which comes from the purple cone flower. This drug activates cell-mediated immunity, and as a result, people take it to enhance their immune function, especially to fight off upper respiratory infections, urinary tract infections, both for prevention and for treatment. Side effects of Echinacea include rash, nausea, and allergic reaction. And while people take them for immunity, they may decrease the effectiveness of immunosuppressant drugs and steroids. And patients may develop immunosuppression with long-term use. More concerning, these drugs can cause hepatotoxicity, and we certainly want to be careful about giving any hepatotoxic drugs to patients who are taking Echinacea. Patients who are immunocompromised should avoid this substance. And in general, we recommend that this drug is stopped 2 weeks before surgery, although there is not strong data to back up this recommendation. Coenzyme Q10 is a substance that has some similarities to vitamin K. It's indicated as an antioxidant to reduce blood pressure in the treatment of heart failure, Parkinson's disease, and cancer. It is a fairly benign substance, although there are some studies that have shown that it can affect warfarin activity, and in fact studies have shown it to both decrease or increase warfarin activity. In general, we recommend stopping it 2 weeks before surgery. Ginger, and this is the same ginger that you could buy at the grocery store, is a substance that many patients take. It works by inhibiting serotonin pathways and also inhibits platelet aggregation. Patients most commonly take it for nausea and also for its anti-inflammatory benefits. Because of its platelet activities, ginger may increase the risk of bleeding, and especially caution should be exercised in patients who are taking other antiplatelet or anticoagulant medications. There's actually no data that says you should stop ginger before surgery, although you'll see many people recommend stopping it because of the potential risk of bleeding. Green tea inhibits platelet aggregation. It also seems to contain vitamin K, and it has action as a diuretic. Patients take green tea for weight loss, for mental alertness, for cancer prevention, and as an antioxidant. Taking green tea can increase patients' risk of bleeding, and again, caution should be exercised in patients who are taking antiplatelet or anticoagulant medications. However, because of its vitamin K, it may decrease the effect of warfarin. So we see a number of different effects that can occur on patients' ability to clot and bleed. Green tea should probably be stopped 7 days before surgery. St. John's wort is a common herbal medication. It induces cytochrome P450 subtype 3A4. It also inhibits reuptake of serotonin, epinephrine, norepinephrine, and dopamine. So not surprisingly, patients take this medication for depression and anxiety. Side effects include sedation and hypomania, and there is some potential risk for a serotonergic crisis. Patients taking St. John's wort, because of the upregulation of cytochrome, these patients may experience decreased plasma levels of a number of different drugs, including antihistamines, calcium channel blockers, midazolam, lidocaine, warfarin, digoxin, HIV drugs, cyclosporin, and many others. St. John's wort should be stopped 5 days before surgery. Saw palmetto has an unclear mechanism of action. It may involve blocking the conversion of testosterone to its active form. Patients take saw palmetto for the treatment of benign prostatic hypertrophy. It may have some effect on bleeding, especially when taken together with anticoagulant or antiplatelet drugs. There isn't much good data on whether saw palmetto should be stopped before surgery, but probably in patients who are taking these drugs, it should be stopped well in advance of the surgery. Grapefruit juice has the opposite effect on cytochrome P450 subtype 3A4. Going back a couple slides, we see that St. John's wort induces the cytochrome 3A4, which means it upregulates it. Going back to grapefruit juice, it inhibits this subtype. Patients commonly take grapefruit juice for cardiovascular health. But what we see is because cytochrome is inhibited, we will actually get increased levels of a number of different drugs and prolonged effect of antihistamines, calcium channel blockers, midazolam, lidocaine, warfarin, digoxin, HIV drugs, cyclosporin, and many others. There's really no clear data on stopping grapefruit juice prior to surgery. That's the end of this recording. Please let me know if you have any questions, and we'll continue in the next video.